Hello, this is Shankar from System-Based Labs. I've worked across regulated environments and medical imaging platforms, and I'd like to share some insights. Today, before we talk about audits, we need to understand something fundamental. Audits don't happen in isolation. They happen on top of a validation life cycle. And if that life cycle is weak, no audit defense will save you. So let's start where validation actually begins. Not IQ, not testing. It starts with understanding the business. We begin with requirements gathering. What is the system supposed to do? What is the intended use? What is the clinical or operational impact? Because if the intended use is not clear, validation has no direction. Now, from requirements, we move into something many people underestimate: business process understanding, workflows, process diagrams, data movement. How does data enter the system? How is it transformed? Where does the model act? What decisions are influenced? Because if you don't understand the process, you cannot validate the system. Now we define structured requirements, user requirements, functional requirements, system requirements. And this is where discipline begins. Now comes one of the most critical artifacts: traceability. We build a master traceability matrix. This connects requirements to test cases to validation results. So at any point, we can answer which requirement was tested, how was it tested, what was the result. Now, auditors don't ask, do you have traceability? They ask, show me traceability. Now comes another critical step: validation scope definition. Not everything needs validation. We identify what must be validated based on patient safety, data integrity, and regulatory impact. They may ask, how do you decide what to validate? We define scope based on risk, focusing on components that impact safety and compliance. Now we move into structured validation. But before that, one important clarification: validation is not define, test, then document. That is a mistake. Documentation is not the final step. Documentation is a continuous layer across everything. While defining, while creating, while executing, we document. If you document at the end, you are reconstructing history, and that creates audit risk. Now we move into execution. Installation qualification. We verify system installation, infrastructure, and configurations. In simple terms, is the system set up correctly? Now, operational qualification. We validate functionality, expected outputs, and boundary conditions. Does the system behave as designed? Now, performance qualification. We validate real-world scenarios, actual workflows, and operational variability. Does it perform reliably in real life? Now, here is where we bring in ML thinking even at this stage. Traditional systems are deterministic, same input or same output. But ML systems are data dependent. So even in PQ, we must think about data representativeness and clinical relevance. Now all of this is executed under an approved test plan. Controlled, reviewed, traceable. When auditors come in, they assume all of this exists. They are not asking, did you perform IQ, OQ, PQ? They are asking, was it controlled? Was it traceable? Was it justified? They may ask, how do you ensure completeness? We explain through traceability, defined scope, and alignment to requirements. Now let me give you the real truth. Audit is not a phase. Audit is a reflection of your life cycle discipline. If your life cycle is strong, audit becomes a discussion. If your life cycle is weak, audit becomes an investigation. Let me leave you with this. You don't pass audits by answering well. You pass audits by building correctly. This is Shankar's view. We have covered requirements, traceability, IQ, OQ, PQ, and ML thinking. This is Shankar from System-Based Labs. See you in the next training session. Best of luck and goodbye for now.